structure in the brain was designed to keep you safe and to keep you alive. It's called the circle of Willis, and it's the source of oxygenated blood to the entire brain. It's a network of blood vessels that all communicate with each other. And if you don't see it, the circle is right over here where my finger is. That's the circle. And it's designed this way to protect the human, the person, if they were ever have an occlusion of one of these vessels. And if for whatever reason you stop getting oxygenated blood to the brain, that's how you get a stroke. And the fact that they all communicate with each other through this circle is what's so important. Now, this structure over here is called the internal carotid artery. If the internal carotid artery were to lose blood flow, then you would think that this entire portion of the brain that gets blood supply from this structure is no longer getting adequate blood supply. But in reality, if a person has this vessel right in the middle called the anterior communicating artery and these vessels called the posterior communicating artery, you now have a network that can provide blood from one side of the brain to the other. And so what happens is that now this vessel is compensating for the lack of blood flow from this vessel and will allow blood to cross the anterior communicating artery and the posterior communicating arteries to be able to go to the middle cerebral artery and to the anterior cerebral artery. And that's really why patients can sometimes have a 100% occlusion of their carotid artery, but still not have any symptoms of a stroke. But not every patient will have a fully formed circle of Willis, which means that if they were to get a stroke in one of these vessels that doesn't get blood supply from the other side, then it's possible that they might have a stroke without a backup feature.